The UniCAP AKR knee resurfacing system from Arthrosurface is comprised of two components. The femoral component is a cobalt chrome articular bearing surface with a titanium taper post that is connected via Morse taper. The cemented tibial component is an ultra-high molecular weight polyethylene with interdigitations on the bottom for cement fixation. In this technique, we will prepare the tibial side first by making a portal a little larger than a standard ACL portal. Select a template and place it over the defect. You must leave a 5 mm bone wall between the anterior tibia and the template, and also the medial wall and the medial side of the template. There is a selection of tibial templates with different curvatures in the anterior-posterior and medial to lateral planes, which you place over the defect and choosing the one that gives you the best recreation of the tibial plateau curvatures in both planes. Attach the template to the tibial drill guide and reinsert, creating a stab incision on the distal tibia for insertion of the bullet. Align the guide arm anterior-posterior and insert the 2 mm drill tip guide pin through the bullet and exit at the center of the tibial template. Remove the bullet and the tibial guide. Advance the tibial pilot drill over the guide wire and through the tibial plateau. Be sure to avoid reaming into the femoral condyle and remove the hardware. Advance the introducer until the proximal tip of the introducer is flush with the cartilage. The next step is to insert the threaded blade stop, which will become the depth stop for the tibial cutter, so that we can create the optimal socket depth for the implant. The blade stop is inserted over the introducer until the laser marks on the driver handle are aligned with the laser mark on the introducer shaft. Proper placement of the blade stop is when the tip of the introducer is flush with the cartilage on the plateau and the laser marks are aligned in the driver shaft. Remove the driver and the introducer, leaving the blade stop in place. The tibial cutter shaft is then inserted through the blade stop and the tibial cutter blade is inserted into the blade holder. The longer longitudinal slot should be facing posterior on the blade. Advance the tibial cutter swivel up and through the center of the blade. Rotate the shaft 90 degrees and pull back. To lock the blade, advance the yellow slide locking hub up and over the hub and release the lock. Remove the tibial blade holder. Begin counterclockwise rotation of the blade to normalize the blade to the tibial plateau, and then clockwise rotation will cut the cavity. Continue until the blade is stopped by the proximal end of the blade stop. Insert the tibial trial into the portal and place over the blade. Confirm the orientation of the tibial trial so that it is flush or slightly recessed medial to lateral and anterior to posterior. If the trial is proud, leave the trial in place and using the wrench, attach it to the blade stop and a 90-degree rotation will lower the blade stop by 1 millimeter. reattach the drill, ream to the new depth, again stopping on the top of the blade stop, and confirm the fit of the tibial trial. When satisfied, remove the trial. Remove the blade and tibial cutter shaft. Preparation of the tibial side is now complete. Next is the tibial implantation. Advance the suture retriever through the tibial hole and out through the plateau. Retrieve the implant sutures and pull the final tibial implant into the prepared socket. Using a slot driver, you can control the orientation from the underside of the tibial implant. Keeping traction on the sutures, we assemble the arthrosurface cement ejector, which is done by putting low-viscosity cement through the funnel and into the syringe. Insert the yellow plunger so that it is flush with the back of the syringe, and insert the syringe assembly into the ejector handle. Attach the drive rod to the handle, and attach this to the handle using the J-lock locking system. The sutures are pulled through the glue shield, and the glue shield is inserted into the distal tibial drill hole. With one hand on the handle and the other on the power drill, pressurize the cement to the underside of the implant. While backing out the tibial hole, you should see the implant rise 1 to 2 millimeters, and then press on the top of the implant using that force to interdigitate the cement into the cancellous bone of the tibial plateau. Continue to inject the cement and remove the cement shield.